Aphthous Stomatitis. Aphthous Stomatitis means after small ulcers in the oral cavity. There may be just one or there may be 5 ulcers. There is currently debate regarding the etiology of this disease. Let's not talk about the etiology, let's just say it's unknown. What is possible? Stress, anemia, or other dietary triggers, for example, certain local trauma. But in this situation, it's important to always remember that there are diseases in which Aphthous Stomatitis occurs against the background of specific conditions in the child. These include neutropenia, inflammatory bowel disease, celiac disease, gluten intolerance, and immunodeficiency condition. It is very important to remember this, and you should always keep it in mind. There are no blisters here. Initially, blisters do not form. Also, you should always remember whether your child is taking topical steroids. It is very important to remember this when inhaling those same topical corticosteroids through a nebulizer. This applies when inhalations are done for bronchial asthma, for stenosing laryngitis or tracheitis. Prevention here is very simple. Just don't forget to rinse your mouth with warm water. You don't need to swallow this water, you just need to spit it out. But it really is worth rinsing your mouth after using topical steroids. This also serves as a prevention for fungal stomatitis. In treatment, local antibacterial agents or antiseptic solutions for rinsing the mouth can indeed be used. I won't mention any brands. If it's allowed, I can mention one and clarify that this is not an advertisement. Tantum verde is used very effectively. Although this is an anti-inflammatory drug, it is not an antibacterial agent, but it is possible to use other medications locally. Most often, local therapy is used for treatment of the underlying disease that may have caused this manifestation in the mouth, because there is a clinical condition called Aphthous Stomatitis. These small round lesions are surrounded by a slight rim of redness, and later they can develop a grayish yellow coating. It's quite clear that this is Aphthous Stomatitis, and it's always important to understand what underlying condition it is associated with, especially if it's chronic Aphthous Stomatitis. In some cases, when we might suspect the presence of secondary bacterial infection here, considering that Aphthous Stomatitis itself does not usually present with severe intoxication symptoms or high fever, maybe just a mild fever or sometimes almost none or even none at all, and you notice that after a few days fever appears, there is pain when swallowing, and the child refuses to eat. The aphthay take on different unpleasant appearance, and the child behaves accordingly, showing signs of intoxication. Even with a high fever, the child remains quite lethargic. The child displays negativism both towards being examined by the doctor and towards the parents. You can clearly see the symptoms worsening. In such situations, of course, antibacterial therapy is used, but in this case it is still advisable to consult a doctor. And antibacterial therapy naturally is systemic, along with the use of various oral antiseptics, whether it's methylene blue for treatment, tantum verde for rinsing the mouth, or other medications, antiseptics, anti-inflammatory drugs. These are all for local use. So here it's always important to clearly understand the line between when local treatment is sufficient and when it's necessary to start systemic treatment with antibacterial drugs.